Hi everyone, welcome to this Tools for Frontline Staff session. This week we've got a sort of focus session on support available for refugees, migrants and asylum seekers. So we've got two presentations from the Welcome Hackney team and Hackney Migrant Centre. So I'm going to pass across to Eden, and yeah, thanks for coming along.
Thank you. Hi, everyone. Really delighted to have the chance to speak to everyone today. I'm just going to bring some slides up on screen, if that's okay. So I'm going to focus in on two specific areas today because we do a lot of different bits of support and thought it might be helpful to focus in on a couple of different projects, but happy to come back and talk about other areas of work another time. And those two areas are going to be around refugee next steps, which is our homelessness support for newly recognised refugees, and our Welcome Hub, which is a pretty recent initiative. But before that, I'll give a little bit of context, and then afterwards we'll be around for any questions. And for those of you who are watching live, I've also popped my email address in the chat, and definitely encourage any ideas, questions, room for improvement, anything, to just come directly to me. That'd be great. So just to make sure we're all on the same page about terminology, for clarity, when I'm referring to people seeking asylum or an asylum seeker, that's someone who's fled their home country due to persecution, violence, or fear of harm, and they're applying for protection in another country. A refugee, in a lot of contexts, is someone who's being granted protection in another country. Migrant is more of a general term for anyone who moves from one place to another. And no recourse to public funds is an immigration condition that's applied to some people that prevents them from accessing certain benefits, but not all of them. So I just thought I would put that there because there's a lot of confusion around the around some of the terminology, and this is obviously imperfect as well, and subject to change in future as well. Within Hackney, we currently support people via 3 different schemes. So people seeking asylum, of which there are around 700 to 800 people in the borough at any one time, who've come from over 58 different countries. People are sometimes surprised to learn just how diverse of a range of people we have seeking asylum in the borough at the moment. Homes for Ukraine, which is 400 guests at the moment on the government scheme. The Afghan resettlement scheme. Ahmad, my colleague, is here today as well, and that's some phenomenal support for 7 families from Afghanistan. But also there may be people seeking asylum, refugees, migrants, living in different types of accommodation in the borough who may need support. And I did want to just acknowledge off top that everyone's experience is completely different, and there's such a variation in the level of education that people have had, English language skills, family composition, which country they've come from. And definitely in my experience of working directly with residents, it's helpful to try and put aside as many preconceived notions as you might have, because really, everyone's story is unique. And what we're aiming to be as a team, the Welcome Hackney team, is to become more person-led than scheme-led that we are currently. As you can tell, I've introduced the 3 kind of schemes that we work on, but we want to move to becoming much more about what does this person need, and then how can whatever entitlements they have through the scheme that they might have come to the country on, how can that help them, or how can we try and get the best help for them. As you may be aware, Hackney Council political members passed a motion last year to adopt a motion to become a borough of sanctuary, which carries with it 5 pledges. I think sometimes the borough of sanctuary work, there can be a question of, what does it actually mean to be a borough of sanctuary? There's actually 5 specific pledges that come with that, which I've popped up on screen. But we want to take that further, and as a Welcome Hackney team, we're tasked with doing a lot of the frontline delivery work with residents, and then also trying to affect some of that systemic change as well. So that's just a bit of context. As I said, I'm going to talk about two specific projects today, and the first of them is Refugee Next Steps. And the aim of that is to prevent homelessness and rough sleeping among new refugees as much as we can. I put a quote on screen. I'm not going to read it out, but this came from one of our resident ambassadors in the borough, who was describing how it felt for them to be facing such a high likelihood that they would become homeless after receiving a positive asylum decision, and they felt very uncertain about what would happen and felt completely abandoned, and like, although there are a number of issues in asylum accommodation, that actually the support they had dropped off as well. And this is kind of what we were aiming to mitigate. And I've also put a link here for when the slides get sent out to a Channel 4 piece interviewing Ali Ibrahim, who's describing his experience of becoming homeless after receiving a positive decision. So this is what we're trying to prevent through this project, by trying to help people find sustainable accommodation to move into after receiving a asylum decision. And that project's called Refugee Next Steps. We're delivering that in partnership with the Single Homeless Prevention Service, and on the ground it's delivered by SHP. So very similar names, but SHP would be the people that you would meet day to day who work on that project. It's running for a year, October 2023 to 2024. The reason for that being that there was something called streamlined asylum processing, and there was a very high number of decisions made. So we really needed extra capacity to support people find accommodation that we could see coming, that our existing services would not be able to support people in the way that they needed, just given the demand. Families are supported by Benefits and Homeless Prevention Service, as any other family would be, and single adults are supported by Single Homeless Project. And as you might be aware, they're working with other Hackney residents already. This was a service with a slightly different focus towards outreach and integration support, as well as the practical housing support. I'm not going to go into loads of detail here, and this will be sent out on the slides, but this is a timeline sort of pathway for the support, how we'd like it to work, how it should work. Obviously it doesn't always work in that way, and that's where that's where the human side of things comes in, to try and make sure that people get what they're entitled to. But there's an incredibly tight window after somebody receives a positive asylum decision where they're evicted from their asylum accommodation. So it's really important that that support is put in place as soon as possible to help them find a house, or if they're in priority need, or if they have dependent children that they're I've just been plunged into darkness. See if I can turn this back on.
Very dramatic.
Yeah, very dramatic. I forgot where I was, but anyway. Yeah, it's very important to get the support in place as quickly as possible, and yeah, to accommodate people if they are in priority need. Where it still helps to have that support start earlier, so that appropriate housing can be found, and that's not a stressful situation for the person as well, even if you know that there's a statutory requirement to provide someone with housing. It's still very jarring to not know that and not be receiving the support and know that that's going to be taken care of. So again, I'm not going to go into loads of detail, but this is a graph showing the number of homelessness approaches in the last year or so, and in red is the new service that we commissioned and that is still taking referrals. And you can see that spike from where there was an increased number of asylum decisions. But what's more importantly is the outcomes, and this I think is something that I hope people who are working directly on the project feel really proud of, because it's the number of people who were supported into housing. On the left hand side, the SHP service, who when I took this data a couple of weeks ago, they'd helped 91 people find housing, which I think is just an absolutely massive achievement, something they should be really, really proud of, because we all know how difficult that is in the current housing context. And on the right hand side, people who have moved into temporary accommodation, which again, I think is something that we should be proud of, because for that person, that's, okay, admittedly not always the most perfect accommodation, but it's somewhere to build on, and really, really important. And we try as much as possible to support them through that transition, but that is an area that we'd like to get better at. So the second project that I wanted to speak about today is the Hackney Welcome Hub, and that's one where, although anyone can refer to the other project, the Refugee Next Steps project, this one I feel might be slightly more applicable, and somewhere that you might want to refer residents on a more regular basis. The Welcome Hub is a space. Sorry, I did nick these slides from another presentation. That's why it says it will be a space, but I can, spoiler alert, it is a space, and I'm in a stationary cupboard just off the side of it, that brings together the services supporting people seeking asylum, refugees and migrants in Hackney. It's held every week on Thursdays, 2 till 5 at Dalston CLR James Library. So we've got flyers there. I'll send out digital versions of those, but I'm also happy to drop off physical flyers if anyone wants to have them on hand. It's open to anyone affected by the immigration system. Children are also welcome, and we just need them to be supervised by a parent or guardian, but the library staff are absolutely fantastic as well for finding little toys and activities. And we also had a very kind woman from the Nather group drop off some toys earlier today, and I've already been able to give some out, which went down a treat. So that kind of, I suppose, showcases the atmosphere that we want to create through the Welcome Hub. We can help with things like housing advice, universal credit, finding ESOL classes, local services and things like that. We're not able to help with things like immigration advice because we're not qualified, same legal advice, and also we wouldn't want anyone to rely on us for emergencies, like if they're homeless on the day. We're not the best place to go for support with that. Having said that, if anyone approached us with any of these things, we would try and our support offer will be to try and help them find somewhere that would be able to help them instead. And that's actually something that's come up quite a lot. People may be coming from other boroughs, although we can't necessarily provide as intensive a support as we would like to, or from a statutory perspective, know that Hackney would be able to provide. We do at least try and make sure that we've given them enough information and proactively made referrals elsewhere so that they're hopefully not getting bounced between too many places. The project's a collaboration with the Hackney Libraries team, who have been absolutely amazing. Firstly, in terms of allowing us to use the space and being flexible with how we needed to use it, but also in terms of the expertise that they provide on actually working with residents, but also the many resources that are here at the library, like the computers, obviously the books, but also books in dual languages or people's first language, activities and things like that, and also just a space to be in Hackney without having to spend money, which, in the winter, that's obviously really important as well. We really want to be a more accessible, open space for people needing support from council services where just a bit more time might be needed because of language barriers, anything like that, or just because actually we just need to take the time to explore what the issue is, and also hopefully some more positive opportunities rather than just problem solving. The hub itself is adapting to meet the needs of people who visit, and by that I mean in terms of who we've invited there. So we did have Hackney Works join us for a while, Hackney Money Hub were with us as well, and actually At the time, in the first few weeks, we didn't actually have many people coming directly for that support, so they're not currently attending, but we're tracking the requests of everyone who comes, and we're going to use that to inform which staff attend and try and adapt there. And also I think what's really important, and I suppose kind of first and foremost is the intention behind the hub, is to provide that welcoming space where the staff are all committed to working in a trauma-informed way. And by that I mean the fact that we've had training in this area, and we're here expecting to deal with some challenging circumstances and how that might feel for someone and how that might make them respond. But it also means we've sort of got other support mechanisms in place, like Curve Garden, which is just over the road from us, have said that if somebody needs a bit of space to have a more sensitive conversation, that we can just use their space as needed, which is an amazing example of just kindness, I suppose, from another organisation, and just helping us use that. Use the space around us to adapt to the needs of residents. Just to clarify, no referrals needed. Please just ask people to come to see us. If we are busy, then we will take details and get back to them another time, but we'll always offer a friendly face and to listen to their problem and then try and support in any way that we can. And I should definitely have included some examples of the support that we provided, but I can come to that another time, because I'm aware that I've used up too much time already. So, in summary, the Welcome Hackney team supports refugees, migrants and asylum seekers in the borough. We do a lot of different work. There's many projects we could have done a spotlight on, but today I talked about two: Refugee Next Steps, which is a partnership between Benefits and Homeless Prevention, our team, and Single Homeless Project. It's open to anyone who received a positive asylum decision while living in Hackney. I will send out all of the leaflets and everything with the slides. And the second project is the Welcome Hub. So it's an open drop-in service for anyone with experience of the immigration system to approach us for support. I haven't put the links in yet, but I will do before sending them out. Just a link to our webpage, a leaflet with a QR code for a welcome pack for people seeking asylum that my colleague Rachel created, some translated leaflets, and then some leaflets for the Welcome Hub, which are not yet translated, but I can share those once they are. So that was it for my presentation. I've put my email in the chat and it's also here. Would love to have any questions, comments, ideas, friendly challenges, either now or later.
Josie, do you want to come in?
Yeah, it's just a quick question. Oh, I've turned my... I did start a bit late, so forgive me if you covered this already. If a child comes in and they're underage and they go under social services, do they still come to you with the housing, or do social services do that? Does that make sense?
Yes, absolutely. Yeah, we would see them as a child first, and as with any child, they would be supported by the statutory teams. And for example, that we have a whole unaccompanied asylum seeking children's unit within children's, which Samira manages, and it'd be in very, very capable hands supporting them with all aspects of their support. Okay, so it's sort of slightly aside to you, but the same thing. It is, but as with any issue, we would want to just take all the information. I mean, for something like that, that would be really urgent. I would get on the phone straight away, sort of thing. We wouldn't be signposting them anywhere else. We'd just make sure that gets handled. Yeah. Lovely. Thank you very much, and a great presentation. Thank you. Thanks, Josie. Good work.
Joycelyn, did you want to come in?
Yeah, I just want to find out if I can have your leaflets on our centre to share it with people.
Yeah, certainly. John, would you be able to maybe connect us via email, and then I can arrange a time to just drop some off in person?
Thank you.
Yeah, no worries. Ali, do you want to come in?
Yeah, thank you, Eden, for that presentation. I just wanted to share a bit of a a really good news story about a volunteer that I've been working with, and he's an asylum seeker, and I've learned so much about his journey and just his experience, and he's equally learning a lot from learning about Hackney. And one of the questions I asked him was like, why did you decide to volunteer? And he said, to get me out of my hotel room, to help me to start to connect with people. And he's gone on to be a recruiter for me. He just talks about the benefits of volunteering. So yeah, it's been a match made in heaven. That came through via Volunteer Centre Hackney. So we're going to do a case study around that. But I just wanted to mention that it's really, I mean, when you said at the start of your presentation about thinking about what asylum seekers are, or if you've got any thoughts around that, kind of leave that at the door, negative thoughts. And I'm not somebody who had those thoughts, but I've been educated, you know. I think a lot of people in England wouldn't realise how much a person is expected to live on, a grown man. You know, they're not rolling in it. Nobody is. And so, yeah, it's been a good experience for me. Look out for like a little press thing on it. Just wanted to share that.
Thanks for sharing that, Ali. That's great.
Yeah, thanks, Ali. I'd love to.
Completely agree on the sort of perception question. I mean, that's a whole other discussion about, you know, the media and all of that stuff. But watching sort of, you know, vox pops and things like that in the run up to the election, some of the perceptions are so out of kilter with the reality. But I guess if that's your only source of information, then yeah, you end up with quite a skewed perception of the situation. Jenny, do you want to come in?
Yeah, I was just going to say that's the second time I've heard a story where we had a meeting with some of the partners that we're working with as community infrastructure organisations. That Charlie and the team made some buns. We had a bit of a sort of celebration at the end of the year. We got together, and one of the people that came from one of the organisations was somebody who lives in one of the hotels and is seeking sanctuary in Hackney, but comes with is actually working as a volunteer for two really amazing organisations in Hackney, doing incredible work on monitoring and evaluation with lots and lots of experience, you know. And it just is exactly as you say, Ali. I mean, it's so difficult that with somebody, but you know, that was somebody reaching out. That person who's volunteering was somebody reaching out saying, actually, I really need to be useful. I really need to be purposeful, but I can't work and I can't get paid to work. But actually, it's really important for my mental health that I get out there and I get involved. But, you know, clearly really great skills and really great understanding about what's needed in Hackney. So I think we're really keen to sort of work with. It's great that you're working with people who are, you know, have the lived experience of settling in Hackney and all that's challenging as well, Eden, so that we can learn as much as possible, but kind of do what we can within those resources to just, to show the strengths in our communities of you know, of what we can do collectively supporting one another. But it was quite amazing to see how much they were investing, you know, given how difficult those circumstances were. But it's, the power of volunteering. And I think that was a wellbeing practitioner. And then that was VCH. So there was, you know, those are the organisations that were kind of key in linking that person up. But I think, it just goes to show we've got such amazing resources in our communities and strengths, haven't we? And it's to see us through challenging times. Josie, sorry, you had your hand up.
That's all right. I was just gonna say that so many people don't realise what someone has to go through to get here. I had a family were living next door to me at home, and I ended up getting involved with preventing them from being made homeless by Waltham Forest Council. I had to get the law centre involved and everything. So lucky they were living next to me, I think. But the nephew had come over to join his sister, and you know, a few times we sat, you know, he just told me about his journey here, and it was just, you just think, God, people look at an asylum seeker and just write them off, and it's that person has, you know, he had to run away because the Taliban had recruited him, and then he'd gone home for a few days, and his mum forced him to leave, even knowing that she put herself at risk. Because, do you know what I mean? And you know, he was in a car boot for 4 days with 2 other people and all this sort of thing. And you just think, that person's gone through so much to get here. We really ought to be giving them everything we can once they're here. Because you imagine doing all of that and then being made to feel like you're unwanted or, you know, not welcome. So anything that's there to help them through the process is good. Well done.
Great.
Absolutely. This is making me, I don't know if this is a slightly, I don't know, bit of a segue, but this is making me thinking of our case studies work, Jenny.
I was thinking the same, John.
Capturing some of these stories. So
yeah,
for those of you who haven't heard about it, we're trying to capture as many case studies as we can. We're working with some academics from University of Sheffield and Hull. It was primarily about the Household Support Fund, but I think we broadened it out a bit, basically to capture case studies of services inside and outside the council who do this sort of work, not just with refugees and asylum seekers, but with anyone struggling, really. Mainly people in poverty, but these are exactly the sorts of stories that would be great to capture and then surface. Yeah, I can share the link. That's all.
Yeah, and I think it's particularly it's the sort of importance of all these relationships and collaborative partnerships, especially for those that haven't got the entitlements to the things that you know, other people that are really struggling might have. It's even more important, isn't it? The relational links and the social connections in keeping people safe. I think the other thing I was thinking about, John, was the you know, we've been working through a case study as part of the council tax. A council tax pilot, and the case study we worked through was somebody who had been in the situation that you described in one of your slides, I think, Eden, of people coming from being sent from the Home Office and information not getting to people when they need it, and then things getting much worse for them financially. So we know we can do so much better with these key touch points of information, and I think there was some really good ideas generated about things that we could try to influence there. But yeah, it's really important to kind of really look at someone's story in context and the role that we play, making it harder for them. Also, I think, isn't it? Sorry, Felicia.
Did you want to come in, Felicia?
Hi, good afternoon. This is my colleague Edna, who works with me here.
Hi.
I just wanted to say thank you, Eden, so much for that service, because it's very, very important. Edna and I both worked as interpreters for immigration and asylum, Home Office and all that. And that's how we got into advocacy, by directing people to the right services, job centers and stuff like that. Because there aren't a lot of places like you have here where people can come in and sit down and have things explained to them properly and be helped. So thank you very much. We just wanted to say thank you for that service, and well done. We did go into the library the other day and found them, and everybody was very, very friendly, very nice. And we took the leaflets and circulated it to all our colleagues and said, oh, there's a new service here. So, well, just to say thank you for what you do. That's all.
Oh, thanks so much, Felicia and Edna, for your kind words. That's really kind. And might explain why it's a slightly busier week this week, but that's why we're here. It's good. It's been successful. Yeah, that's great. Thank.
Yeah, it's lovely to hear from you, Felicia and Edna, about your experience of being in there. Are there things that you would like to see there, or things that we can do more of? You've got, you know, you're obviously, yeah, you've got so much knowledge and experience in supporting people in that situation, and we know how hard it can be for people to go into a building they don't know. And is there anything we can do more or better or differently that might help you to help them?
So far as I can see nothing. I can't see nothing. Like I said, the lady on the reception sitting at the desk was so friendly, so lovely, and that's all people need. The welcoming attitude that is given to them, I think, is ever so helpful. Just breaks down the barriers, you know, and helps them to be able to come in and confidently trust. Once that trust is there, they will tell you everything. So yes, thank you for that.
Amazing. Big clap to your receptionist there. The meet and greet person is the most important.
Yes.
Absolutely, yeah, no, it's essential. I would say I completely agree with that, and the sort of thing that doesn't come across in our evaluation or any of the data we capture or anything like that, but informally we're kind of looking to see how people are when they're leaving. I'll always, on the way out, we'll try and ask people like, how was that? Is that okay? And we know we've done a good job when somebody's arrived and they seem quite nervous and they're in on themselves. They, you know, people can be quite upset or angry. And so far, not for everyone, obviously, because there's a lot that we just can't help with. And I understand why people, you know, that they don't feel good leaving. But where we do a really good job is that I think most people seem to leave here laughing and smiling, and that seems really good. And that I think is something valuable in itself. We just have to keep continuing to do that and make sure we're not getting carried away with that and not focus on the practical stuff as well. But I think that's really important.
One thing you could probably get, you might get a few people volunteering. If you want people to volunteer as interpreters for you, I think you should be able to get a few people willing and save you some money, because other people would volunteer, especially if they profited from the service. They would come back and volunteer to help others. So that's something you might want to look at. I would. So, you know.
Oh, that's a great idea.
Yeah.
Great idea.
Save you some money. Yeah.
Yeah. That's amazing. And I was just going to ask as well, Eden, what are the sorts of things that you haven't been able to help people with? Is it mainly the sort of legal advice and the sorts of things that help them with their applications, or is it access to services, or what are the kind of key things that are really hard, the times when people walk away and you haven't been able to help and then you feel really disappointed that you haven't been able to help?
Yeah, definitely. The ones where you go away and you kind of like, that, you know, what was the point? We're generally relates to housing and homelessness, because we do have that other project, as I mentioned, that's there, but that's operating within a very difficult context of, you know, housing wise. So there can be challenges there, but even more so if there's someone who's come from a different borough, and I know that there are very strict local connection, you know, how local connection is determined to a borough. And what we don't want to do with the Welcome Hub is be another place where there's like a really strict border and saying, okay, like we can't help you because you happen to live in Islington or whatever. We will try and provide the support. We will usually try and connect them with some support locally, because they'll probably be more informed about what services are available and things like that as well. But with homelessness, we're not able to do that, and there's so much that's out of our control that's probably the main one. Obviously, things around immigration advice, if it becomes you know, something that we're not able to advise that anyone takes a particular course of action, so sometimes that can feel unhelpful. So again, we just try and give people the information that's available, try and help connect them with people who are able to provide that advice. And we work really, really closely with Migrants Organise, who we're funding to do drop-in services inside the hotels where people live, and they're doing an absolutely phenomenal job. And they are able to give immigration advice on certain matters as well. So there is some capacity there, although they are extremely busy. So yeah, those two things really.
That's helpful. And can I just ask, you did say you could talk about some of the things you have really been able to help, obviously without giving anything that might identify the person by their circumstances. So what are the sorts of examples of what have been some of the most impactful types of support you've been able to give in this piece of work?
Yeah, definitely. I think it's usually connecting people with different services, which can kind of feel like it could happen anywhere, or maybe people might be able to find it there on their own, which may be the case. But in the first 6 weeks of the hub, I think we spoke to about 40 people and worked through different challenges with them. For me, the ones which I really felt like, okay, this is really working, were if parents came in with children and the children were able to get, you know, a bit of attention from the library staff and other people around, and it meant that their parents could focus on having a conversation with the staff and working out where to go next, you know, in their journey. So yeah, that would be one element of it, which is more about how the hub operates. Practically, I think some of the most helpful things have been helping people escalate practical things like issues with universal credit or not receiving certain immigration documentation, and being able to kind of give some local authority welly to that request and follow up on it. And I think I'm thinking of a specific example of, you know, it does take a few weeks for these things to kick in and to actually, you know, for documentation to be issued and things like that. But the fact that we're here every week, I feel it's reassuring for people, because you can leave it and they'll say, okay, I'll be back next week. And they know that we'll be here next week, and it's not just that was your chance to get support and it's gone. Other examples have been, yeah, being able to really spend the time with people and speak to them via an interpreter on the phone, for example, is something that we do, or several members of staff in the team speak multiple languages, and they're able to disclose things that potentially, I think, hadn't come out through other routes, and we're able to sort of kickstart the support you know, support process for things around like domestic abuse and things like that. Yeah, there'd be some of they're the examples that come to mind. We want to write up some proper case studies as well.
Yes, please use our tool and give us lots of the case studies, because it's really that's what we're really asking, is what is helping you to help people, and what are the things that you're struggling with, so that we can really surface that and have a better understanding of what we can do to influence the change on that, if anything. But it sounds, yeah, it's amazing piece of work. Thank you so much, and great ideas from our colleagues on the call there, Felicia.
Thanks, Jenny.
Absolutely. Thanks, everyone. I'm going to jump back into the hub now, but please do email me if there's any thoughts, questions, and I'll share the slides and the resources as well.
Thanks, Eden. Thanks so much for coming along. Great work.
There you go.
Amazing. Yeah, amazing work from Eden and the team, and what's a relatively new service still. So yeah, if you've got any other questions for Eden, you can send them on to me and I can forward them on, and I'll send the slides out and the leaflets and all of that, all of those resources in the newsletter as well. We are going to move on to our second presentation. Excuse me. So Haneet has come along from Hackney Migrant Centre. So just for some context, Hackney Migrant Centre have been doing a great job in administering a grant from the council for people with no recourse to public funds. So Haneet's going to talk a bit about the work they've been doing. So I'm going to pass along to Haneet.
Hello, hi everyone. Like John said, my name is Haneet. I work at Hackney Migrant Centre. So I'm just going to see if I can share my slides. Sorry, I don't usually use Google Meet, so might give me a sec. Is that working? Can anyone see? Can you see the slides?
Yeah, it's just loading, but I think it will work. Yeah, we've got it.
Fab, thank you. So Hackney Migrant Centre, if you haven't interacted with us before, we provide free weekly advice on immigration and housing predominantly. So we have immigration and housing teams. The housing team also deal with welfare access, so benefits, asylum support, that sort of thing. And then we also provide holistic support. So we've got a really amazing team of volunteers. I think we have somewhere between 50 and 60 volunteers who provide all sorts of different kinds of support. We do lots of holistic support, so things like bus passes, HT2 certificates, preschool meals, all that kind of thing. A lot of the stuff actually that now the Welcome team do at the drop-in in the Dalston Library, which is really great that they've started that. We're really happy about that. I wish Eden was here. I would have given my thanks as well. Yeah, most of our visitors lack secure immigration status, and I don't have a figure for how many, but a large majority have no recourse to public funds, and we welcome all migrants regardless of background. So the MRPF fund, it's, let me go back and just explain. So as John said, we received this fund from Hackney Council, and it's for those with no recourse to public funds. I'll go into a bit who is actually eligible for the fund. The way it's set up is that we hold the grant fund at HMC, and then we have several partner organisations, and those partner organisations put in applications for individuals to the fund, and then we administer it directly to those individuals. So partner organisations within Hackney Council, we have the NRPF team in Children's Services, the MASH Multi-Agent Safeguarding Hub, Welcome Hackney, so the team that Eden's from, Adult Services, Benefits and Housing Needs team, and then BCS organisations, so sort of charity organisations within Hackney. We've got ELAT, Aquaba, Shepherd Fold, Idias, Muso, Canlungan, KMEWO, Side by Side, ROJ Women, and Abtax us on the end because we also make applications, so Hackney Migrant Centre. So people who will be eligible for the fund who have no recourse to public funds, I'll put in a slide about what that means before I send this to John for him to send out. But essentially, you can either have no recourse to public funds attached to your visa condition. So someone might have, for example, limited leave to remain with no recourse. That means they can't access mainstream benefits and social housing. You can access some benefits, and Eden touched on this, like contribution-based benefits, but majority of benefits you can't access. The second point, connection to the Borough of Hackney. This is quite broad, so it means if you're living in Hackney, that's the easiest connection. Living in, working in, children that go to school within, if you go to college within Hackney, if you're working in Hackney, volunteering in Hackney. And then we also accept applications for those with unstable accommodation or no fixed address who are being supported by organisations in Hackney. And that covers people. That also covers people who are in accommodation, such as asylum accommodation, Section 17 accommodation, Care Act accommodation, where they've been placed across London because they had no fixed address, because they were homeless. They have then no choice over where their accommodation is, and they're being supported still in Hackney. I hope that makes sense. Please ask me at the end if that doesn't make sense. And then the last part, in need of essential support, there is a list of things that we've put what might be classed as essential support, but if you have no recourse to public funds and you're being referred by one of our partner organisations, the likelihood is you just need some extra help with essential needs. So the process is just that you fill in the referral form with your visitor. We call them visitors, some people call them service users, if anyone's not sure what I mean. If you're filling in an application for emergency accommodation, then you call me as soon as you fill in that application. I'll explain what that means as well. But otherwise, you just fill in the form, you put the applicant's phone number and email address, and that form comes straight to me. And then within 7 working days, I'll have looked through it, just check that the person is eligible, and get in contact to organise distribution. And it says on the form whether the person would want cash or bank transfer. It gives the opportunity to put bank details, so the person doesn't have to travel if they don't need to. Oh, I apologise, that's the wrong heading. Okay, I'll fix that before we send that round. That should say payment structure, and it's £100 per applicant, it's £50 per dependent, and it's a cap of £250 per application. So for example, if it was a single person, it would be £100. If it was a single person with 2 children, it would be £200. But if there's a particular need, we can exercise discretion, that's fine. But that doesn't come up very often. People don't typically put that they need something, but for example, if you needed to buy, a particular piece of uniform that was going to cost, well, that's not a great example, but it was going to cost £120 for, your kid's full uniform set, then obviously we can exercise discretion when needed. It's a one-off grant, so we don't take repeat applications. So once someone applies to the grant, that's the only time they'll receive the funds. So the emergency accommodation provision that I mentioned earlier is slightly separate to this. It still works within the same payment structure, and you still fill in the same form. But if you're working with someone who needs emergency accommodation for that night and you can't it can't be provided through any other channels, you can give me a ring and just ask me to look at the application immediately, and I will, and then I will it's just to check it over and make sure that the person is actually eligible for the grant, and then I will let you know how much they would be eligible for, and then you can book accommodation up to that amount. Obviously, if you want to go over that amount, you can do so, but that we would only be able to reimburse up to the amount that we would provide the grant for. So this grant's been open since the 4th of September. And the main needs that people have identified have remained the same, roughly. The main needs, food is always the #1 reason that people are applying for the emergency grant, because they struggle to afford food for themselves and their families. Particularly for those living in asylum hotels, we did have a bulk of applications for from the Welcome Hackney team, where they went into some of the hotels in Hackney where asylum seekers are being housed at the moment. And so that maybe skewed our data in terms of how many people require food because they live in asylum hotels. But still, it is a major concern. And then clothing is always second, both adults and children. Throughout the winter, it was particularly warm clothing, but even now in the summer, families are still struggling to afford clothing. And it is usually families, I find, that are applying for help with clothing, but obviously some single adults too. Children's supplies, so that can be anything from children needing school supplies to needing baby supplies, so things like nappies, like feeding equipment, anything that a new mother might need. For that, there is a big network of baby banks in London, but we refer to baby banks all the time, and they are almost always at capacity. I'm sure some of you have interacted with the baby banks in Hackney. They're amazing, but they are under pressure. And then the last one was just some people they just apply for sort of general needs, but when someone has no recourse and they are applying through this grant, that usually just means they just need essential living support. So that's like transport, food, maybe going to the pharmacy if they need medication, that kind of thing. That's all I had on the slides, because I didn't want to go through it too much in depth in case this wasn't relevant for you. But that's my name, my email address, and my phone number. If you're interested in making referrals to the fund, I'd love to hear from you. We can have a proper call and I can go through everything with you and see if it's something that your service users might really benefit from. I'm just going to come out of this and I'm going to show you, just look at the eligibility criteria. So like I said, so this is no recourse to public funds. You have leave to remain and you're subject to the NRPF condition. And this I missed earlier, which is obviously very important. Those who are undocumented or have irregular immigration status, who de facto have no recourse to public funds. And just lists, I think, families who are accessing Section 17, so obviously Section 17, Care Act support, these are not public funds, so they're still eligible. Same for those on asylum support, it's not a public fund, they're still eligible for a grant. And then be living in, have a suitable connection to Hackney. I think I went through that, but if you have any questions, I'm more than happy to answer. And then this is a list of what we might class as an emergency need, but this is very open. We completely understand that each person will have a different concept of what is an emergency need for them, but it's just there in case it's useful for you to refer to. And in terms of emergency accommodation, we think that for a single person, it really depends on people's needs. We think that we should be able to cover 2 to 3 nights of accommodation for an individual and maximum 5 to 6 for a family. This provision has not been taken up as much as we expected. I think this is for a couple of reasons, but the main one being that I think our referral partners, when they're working with people who are rough sleeping, either the person who is rough sleeping has been rough sleeping for an extended period of time and would prefer or would benefit from the cash support as opposed to a night or two's respite. But also, and this was raised actually recently by the NRPF team in Children's Services and by our own caseworkers at HMC, that because it's such short-term support, a lot of caseworkers are anxious about what would happen after that ends, if there's no secure follow-up. And a lot of caseworkers want the council. Well, we should all actually want the council just to pick up the powers that they have where they should. So something like a family who's about to be street homeless with children, this grant could absolutely be used to cover them for a few nights, but I think most caseworkers seem to want to access the council support where they can. But it is there, and if you're interested in any part of the grant, please let me know. I'll just show you the application form now. So this is the application form. There are lots of, it's not as long as it looks, I promise. It doesn't take a very long time, but how does the applicant meet the definition of no recourse? And you can refer to eligibility criteria, or you can just drop me an email if you're not sure, or if you want me to run through what that might mean. And then it's a bit of demographic information. This is kept within HMC, and this isn't shared in an identifiable way with Hackney Council. So you can make that clear to your visitors when you're working with them. We know that there can be concerns about how information is shared. And then if you're not resident in Hackney, please explain the connection to Borough of Hackney. That's the part about, okay, what would your connection be if you're not living in Hackney? And then the reason for the grant request. And if you need anything extra, and that's it. And then you have an opportunity to put bank details. And that's the end. Very straightforward, I promise. So yeah, that is everything really that I wanted to say today. Hello? Okay. If you have any questions, let me know, please, either now or drop me an email. I'm more than happy to talk. I'm really open to bring on some new referral partners. So if you think that it would be helpful for your organisation, please let me know, and yeah, we'll have a chat.
Amazing, thanks, Lee. I think we've got Fiona from CAB in the chat is saying the CAB would be really interested. Fiona, I don't know if you wanted to come in and elaborate, or I can put you in touch with Anit. And Charlotte as well. Charlotte, did you want to come in? I'm actually not sure which service you're from. Apologies.
Yeah, no worries. I'm one of the safeguarding midwives. Penny, I'll pick up with you after, just because I don't want to kind of disclose stuff that could be confidential. But yeah, I'm supporting someone at the moment who's overstayed their visa and is at risk of homelessness. And yeah, would really need some support. So it's great to hear about this. Thank you.
Yeah, thanks, Charlotte. Actually, one of our caseworkers said the other day about whether I'd been in touch with anyone, any midwives, anyone from the NHS, because she's been working, I think with a midwife at the moment. So yeah, definitely let's chat.
Yeah, perfect. Thank you.
Thanks, Charlotte. Anne-Marie, did you want to come in?
Yeah, it's just to add, really. Obviously, I work with Charlotte too, and it's interesting because just recently I had a client that that basically applied for asylum. So it's not necessarily about the visa, but she was awaiting support. She didn't have any funding, literally nothing. And from a midwifery perspective, it was very difficult to try and get her help and support. And I do remember contacting the no recourse team at one point, and they were like, sorry, we can't help at this point, because clearly they're saying the fact that she's applied for asylum, it should be the Home Office. And I did try to contact the Hackney Migrant Centre, but the number on the website only allows us to call between a set time. And no one actually called me back, to be fair. However, it's
very embarrassing. I'm so sorry.
No, it's fine, but it was a big struggle because I really didn't know what direction to turn with this client. And, you know, obviously to hear that there's a fund as well, that she could have got an emergency fund to support her. Obviously children's social care, like I said, wasn't able to support her. Adult social care said that it's out of their remit. And so literally it got to the point where she gave birth and was in the hospital just waiting for someone to help her to find accommodation. And we had to call the migrant help and obviously go through that process. And it took a number of days before they actually accepted to find her placement and so on. So it is so useful to be here right now and hearing what you're saying and stuff. It just makes sense. Just like Charlotte says, there's many of our clients that we come into this situation and we're not sure what angle to go. And you just feel kind of like you're on your own as a professional, because ideally we should have support networks that we could reach out to, but it wasn't like that for this client. It's really sad. But yeah, this is really useful and I really appreciate it. I will be contacting you.
Please do, yeah. I really am so sorry that you didn't get through to HMC, because we would have treated that as an emergency. So yeah, I'm really sorry about that. And yeah, please do get in touch with me.
Thanks, Anne-Marie and Charlotte. Sounds like it sounds like Safeguarding Midwives would be an excellent new partner. Jenny, did you want to come in?
Yeah, so on that, we've been working with, so Charlotte and Anne-Marie are some of the midwives who are in a team, obviously working with quite complex and vulnerable residents and patients, but also one of our trusted referral partners. And we're working with Homerton Hospital at the moment to create a role that can help the clinical services that are based in the Homerton, including midwives, but also health visitors. And what we're hoping to do with that role, it's just a 6-month role using some of the household support fund. But we're hoping to work with that role so that they can build direct relationships with people like yourselves, Haneet, so that it makes it easier for midwives or health visitors or the other clinical services that are working with patients who, they're needing to support in the moment, to sort of have a fast track through to you. So then it makes it easier for you, but it also makes it easier for the clinical services to get that support. Because I think that's exactly an example, that example, Anne-Marie, it's so distressing to hear that. And it's such an example of something that we could do to support it, because you obviously, you've only got so much time in your clinical day. You've got so much to do as a midwife, haven't you, in terms of thinking about the baby's health and all of that. And yet, that if they don't have the money, then the mum's not going to, they need that too. So it's just,
it's definitely very stressful, as well as, heart-rending to see someone that's struggling and you're like, you feel helpless, absolutely helpless. You're like, I've tried, I've referred here, there, early help, even they were like, no, can't yet. Well, we can, but we can't. It was really difficult.
So sorry.
So, thankfully, she has been supported now, but it was a journey definitely to get there.
Well, we'll definitely, Anne-Marie and Charlotte, we're definitely going to be reaching out to you and your team once that role's in post and asking them to think with you about the kind of help you need and the support you need. Definitely. And we'll be making sure that they have the contacts with this, that they can come to this group regularly, but also that they could have a kind of connect into Haneet and the service and the Welcome, all the different sort of supports that are around that might really help you to help patients and mums to be and families in that situation, because that just must be brutal. I really wish that mum well and amazing work you're all doing.
Yeah, definitely. That sounds very good. It definitely will help us. So we'll be waiting for that, definitely.
Thanks, everyone. Does anyone else have any questions for Haneet? Anyone else interested in sort of taking up the offer, or questions generally about NRPF and the support that's out there? Okay, I would just say, it's an excellent resource, and Haneet's done an amazing job in working with all the partners. So we did, like Haneet said, try to make that application form as relatively simple as possible to get the money to the residents who need it as quickly as possible. So if you are interested in joining, I'll be sharing Haneet's slides, which has her email, or you can get in touch with me and I can put you in touch. Feel free to take up the offer. Josie, did you just have your hand up? Did I imagine that? No. Okay,
Sorry, I
Cool.
was just hot.
Oh, no worries. No worries. It is throwing up. Amazing. Well, thanks so much. Oh, Henny, do you want to come in?
No, I was just going to say this isn't related to the NRPF grant, but Felicia, I'm putting a message in the chat for you about community interpreting in case, just in case you miss it. Just let you know.
Amazing, thanks, Henny. And I can put you in touch if that's helpful.
Oh.
But Felicia, did you want to respond?
Let me have a look. Oh.
Hello.
Oh, okay.
My email address is there as well for anyone else that wants it.
Yes. Actually, Edna and I were just saying that we wish we could volunteer. She was saying to me, why don't we volunteer? And I said, well, we need to work out days when we can do that and volunteer for that. So we will get in touch with you and give you the languages we speak.
Please do, thank you.
So you can, because we all work part-time, but it's just, sometimes it's a bit difficult. So yes, we will get in touch and tell you what we do and the languages, and we'll be happy to help, especially if it's online.
Thank you, it's really helpful.
Edna has actually volunteered there before, so. And she says, Edna, go on, you talk, say something.
Yeah, it's the timing, so I don't know.
We can
I've worked with Hackney. Yeah, I've worked with Hackney Migrant Centre.
That's amazing. Thank you.
Thanks so much, guys. That'd be great. Jenny, did you want to come in?
Yeah, I just wanted to say that Bhupinder in our team, I'm not sure, Bhupinder doesn't generally work on Thursdays, so wasn't able to attend today. But I think that, Felicia, you may have met Bhupinder or been connected in with Bhupinder previously or separately, and Hanit as well. But Bhupinder's going to be doing some sort of focused work coming out to meet some of the organisations that are working to support those seeking sanctuary in Hackney, to understand, you know, what kind of helps you to sort of what really is what needs to change, what would really make the difference, and to really learn from your experience and to get some of you together. So Bhupinder will have the recording from this meeting. And if it's okay with you, she'll get in touch with you directly. And
that's fine. I'll be happy to help in whatever way I can.
Oh, wonderful. Well, we want to be able to help you to do the amazing work that you do, because it's incredible work you're doing anyway. And then to be offering up more of your time, we want to understand how we can support you.
That's fine.
I think
we'll do what we can.
Yeah, exactly. Amazing work, and amazing work, Hanit, as well. Thanks, Felicia.
Yeah, thanks so much for coming along, Hanit. Sorry, go on, Julie.
Yeah, I was just saying, because it says Felicia, we keep forgetting Edna's name too. Like, I keep forgetting. We need to change it so it says Felicia.
Felicia and Edna, yeah.
Amazing. Cool. Thanks everyone for contributing to that discussion. Yeah, really pleased that there's a few people who are interested in signing up as well. That's really good news. So they were our two presentations for this session. So yeah, we thought it would be good to have a focus on the needs of refugees and migrants. But yeah, we've got about 20 minutes left, so we usually use this time for just an open discussion. So if anyone has anything they want to ask a question about, we've obviously got lots of varied experience on the call as usual. So if anyone has a sort of issue they're concerned about, or something they want to share, promote, a shout out, positive good news story that they want to share with the group, which has been really nice to hear the last few sessions, I think. Feel free to jump in. Now's your chance.
Josie looks poised.
Josie, you look like you're going to say something.
Looks so poised.
I was reading the messages. I know I'm always the one to talk, aren't I? But
no, you always have such good news stories, because you're always going above and beyond, and we know it's not easy in your service.
Oh no, everyone here does. Do you know what I mean?
I know.
That's why I like coming here. It gives I hope all of us a boost to see what's going on out there as well. Do you know what I mean? So, aren't we brilliant? Yeah.
Ripples. I often think about all the ripples you all create in all your amazing work, and you're never going to know how much you've done for somebody, you know, and you just have to hold on to the fact that you do great work, and it will have a huge impact.
I've got friends, quite obviously, as probably we all have, that work in the private sector and all, you know, like outside of council, don't do anything like this. And I just think there's no way they can get the same job satisfaction that I do.
Oh, excellent. Oh, well, maybe that's a good question. What do you love most about your work, colleagues?
Well, I'll go first. It's just that thing when you take the time to listen to people, which not everyone has, and they engage with you, and you can just tweak and tweak and tweak and gradually turn around their way of dealing with things. That's because I look on it as an opportunity to sort of try and train people how to manage things better as well, because some people just haven't learned that skill, you know. One girl, I'll do it quickly. One girl, I might have said this before, but one girl, very young, a few years ago, I was helping her with her property, you know, she'd been housed in, and she came in with this big pile of paperwork all over the place and phone calls. She wasn't sure who'd rung her when. So next time I met her, I'd bought her a little folder with all, you know, partitions in, and I said, right, put a blank piece of paper at the top and put your bills from British Gas underneath, and whenever you talk to British Gas, on that bit of paper you write a note, and any new bills you put underneath. And about 2 weeks later I saw her, and she came in with this immaculate book, everything noted, all the bills in date order, and she just said, I feel so much more in control now, it's not all sort of scatty in my head. And do you know what I thought? I wish I could do that for myself, because I don't know good at that sort of thing. There we go. We're all good at giving advice, but we don't follow our own, do we?
Absolutely, absolutely. Fiona's laughing at that. Have you got a story on that, Fiona?
It's more an everyday occurrence for me, to be quite honest. It's not even like a one-off story. But yeah, I think without it sounding too selfish, because of the way it makes me feel by like helping others, it is just about, I don't know, I think because I've got lived experience as well, so just knowing like it's the small differences that you make for people, like making TA bearable. Well, it's not bearable, a bit of a joke to be quite honest, but like, you know, so that you can survive it. Survivable, that's the name for it. But yeah.
And what are the sorts of things, I can kind of imagine from what you're saying, but like, what are the sorts of things that do make it survivable for people that you know, in your experience, what are the sort of common themes? Yeah.
It's the links that you make, and actually being seen for not just being another homeless person, but somebody who's actually got skills, knowledge, experience beyond their lived experience. And I think somebody said it before, just being seen as well, because you are, when it comes to the system, whether it be the benefit system, housing system, whatever system it is, you are very much kind of managed as a number, because there is just so many. I've also been on the other side of it, like being in public services, and the demand and the caseloads and the capacity issues and everything like that. But when it's actually your daily life and your whole being, especially if you're a parent with a child, because then you've got huge guilt issues as well. Like, what have I done to my child? It's one thing being a single adult, but when you're dragging children along with you as well, it's very hard to maintain any kind of sanity, really. So it is about being seen, being heard, and being recognised as a person and not just a homeless figure, I think.
Gosh, that sounds so powerful. I think it really chimes, doesn't it? I mean, I used to be a social worker, Fiona, and and it's so important, isn't it? But all of our, it's always about risk and deficit.
Yeah.
We sort of plan for the problem rather than see, the whole person in their context and all the things that, they have the capacity, the power to do, if only the system didn't work in the way that it did, or if only these other things didn't undermine it or make it so difficult. So it's just, that was so beautifully put. I want to lift that off this recording as a really good quote, Fiona, and I will ask for your permission to put it on a slide deck when we're talking about the importance in this work, because that was a really, yeah. Anyone else want to come in on, yeah, what Fiona and Josie reflecting on about the work of supporting residents? What matters in the work for you? What do you enjoy about the work most? I know that I know that all of you have got really good news stories and things that make you buzz about the work. We know there are things that make your heart sink every day too, and that you feel really disappointed you can't help with. But what are the moments that really make you think, yes?
I think everyone's got the heat.
Yeah, we can end. I mean, we take all of what you're sharing. Oh, Ali's turned the camera on.
Yay.
Come on, Ali.
I was going to say that, so today has been a really, can we, does it after we recorded this bit, or?
We can turn the
recording
off.
Yeah.
Give me a moment.
Yeah, it's good to share. You had a tough day.